Hello everyone. We are happy to share our work EcoSanté lifestyle intervention, encourage reflections on the connections between health and environment. We have a problem of overconsumption. We are not only overweight but also over energy weight. The United States is the world's second largest consumer of electricity, and that obesity currently affects 4 out of 10 Americans. In general, people are not fully aware of the environmental impact of everyday activities such as eating, shopping, and transportation. We have effective technological solutions being proposed to help us become healthier and more pro-environmental. But, are there solutions that help people engage in behaviors having both health and pro-environmental implications? Our work aims to address this challenge by asking how can we encourage people to act in ways that are mutually beneficial for themselves and the environment. We define sustainable lifestyle behaviors as routinized actions individuals engage in that have both pro-environmental implications as well as associated benefits for personal health. The concept and importance of sustainability in HCI focuses on environmental sustainability with the goal of reducing resource consumption, such as reductions in electricity, water, and carbon dioxide emissions. The idea of EcoSanté lifestyle intervention is based on 3 inspirations. First, prior research has shown that pro-environmental and health behaviors are positively correlated and share common motivational roots. Second, concepts such as exercise-based transportation and active travel are examples showing the potential that problems of obesity and pollution can be reduced through biking to work. Last but not least, research suggests that multiple behaviors can be targeted simultaneously in a single intervention if people understand that the behaviors are related in terms of their desired outcome. Our study design was informed by 3 areas of research. First, the concept of small, the easy-to-accomplish daily changes, has been shown to be an effective approach to engage people in positive changes, such as improving dietary fat intake and physical activity to prevent weight gain. Our EcoSanté lifestyle intervention engages people in one easy-to-do challenge per day. Second, much prior research highlights the importance of personal gains and associations with a desired behavior because clear personal gains and benefits motivate people better and enable them to have better understanding of why to engage in a desired behavior. The daily challenges included in our lifestyle intervention contain different types of benefit statement. Third, research on theory of active involvement has suggested that engaging people in creating intervention content for themselves can help lead to positive changes in attitudes, intention, cognition, and behavior, such as creating anti-smoking campaigns for themselves. In our study, we invited participants to come up with their own challenge or modify an example challenge on even days throughout the entire study. These have led to our 2-by-2 intervention design. On the one hand, the intervention varies by the absence or presence of health benefit statements in the behavioral challenges delivered. On the other hand, it varies by asking participants to come up their own challenges or not. In other words, as illustrated here, participants in conditions 1 and 2 received challenges containing statements describing their benefit to the environment without corresponding statements about how their health benefits. Those in conditions 3 and 4 received statements explaining both environmental and health benefits for each challenge. For the other dimension, as shown here, there were 2 levels of user involvement. Participants in conditions 2 and 4 were asked to come up with their own challenges on even days of the study, while receiving fixed challenges on odd days. We sent an example challenge to help facilitate their thought process. They had the option to modify or personalize the example challenge, or to come up with new challenges from scratch. Participants in conditions 1 and 3 only received fixed challenges. Specifically, we aim to answer 3 research questions. First, how did participants' behaviors, self-efficacies, and psychological well-being change as a result of the intervention? Second, how did participants qualitatively feel about the intervention design, content, and frequency? Third, how does the addition of a health benefit statement in daily challenges impact the intervention outcomes? Does inviting people to create their own challenges impact intervention outcomes? A total of 20 behavioral challenges were used in our intervention study. These challenges were adapted from books on leading a sustainable lifestyle as well as relevant internet resources. These behavioral challenges cover 5 areas of daily living, including eating, exercise, resources consumption, information or fact-finding, and transportation. For our study procedure, participants began by filling out a pre-study survey consisting of several existing survey instruments on 3 behavioral and 5 psychological measures. Then, they began the 20-day mobile intervention study. The app delivered 1 unique behavioral challenge to participants per day. They were asked to describe in the app what they had done to meet the challenge. At the end of the 20-day intervention, participants were asked to complete a post-study survey containing the same set of questions used in the pre-study survey. We also invited participants with both high and low challenge completion rates for online interviews to talk about their experience. 1 month post-intervention, participants completed a follow-up survey, which aimed to understand how their behaviors, self-efficacies, and psychological well-being developed over time when they were no longer exposed to our intervention. Based on participants' challenge submissions, survey responses, and interview data, we share several finding highlights for each research question. Our first research question asks, how did participants' behaviors, self-efficacies, and psychological well-being change as a result of the intervention? A total of 1,921 challenges were completed by 139 participants. The average completion rate across 20 challenges was 69.1%. We measured participants' eating, exercise, and pro-environmental behaviors, general and domain-specific self-efficacies and psychological well-being at 3 times throughout the intervention via self-reported surveys. Our general linear regression analysis found significant improvements in participants' self-reported eating behavior and general self-efficacy right after the 20-day intervention. In addition to eating and general self-efficacy, participants' perceived exercise and pro-environmental behaviors improved 1 month post-intervention when they were no longer exposed to the behavioral challenges, compared to before study participation. Our second research question examines how did participants qualitatively feel about the intervention design, content, and frequency. Participants' most favored intervention feature is the benefit statement listed underneath, "Why I should do this." Regarding their reactions to the content variety and frequency of challenges, the majority of participants preferred receiving 1 different challenge per day. However, some participants mentioned receiving some challenges more than once would help them ingrain the challenges into their routines and serves as a good follow-up or check-in. Our participants provided several ideas of repeating intervention content while keeping the content diversity. Our third research question examines the effect of the experimental conditions on challenge completion rate and outcome measures from the surveys. Specifically, how does the addition of a health benefit statement in daily challenges impact the intervention outcomes? And, does inviting people to create their own challenges impact intervention outcomes? Unexpectedly, participants in conditions 3 and 4 who received challenges containing both stated health and pro-environmental benefits statements did not complete more challenges than those in conditions 1 and 2 who received challenges containing environmental benefit statement only. Nor did participants in conditions 2 and 4 who were invited to come up with their own challenges during the intervention completed more challenges than those in conditions 1 and 3 who received all challenges from the researcher. Despite of these, both the outcome measures from surveys and our qualitative data revealed some interesting findings. One being that the general self-efficacy of participants who received challenges containing stated health benefit statements significantly improved from pre- to 1 month post-intervention. We would like to share 2 reflections based on these findings. First, while we know the effectiveness of the small challenge intervention approach, there is lack of information in existing research regarding specific strategies or steps people can take to come up with small steps in the context of everyday life. We suggest future researchers to systematically experiment with some strategies employed by existing mobile applications, such as differentiating milestones from activities and emphasizing daily plans. Second, We believe highlighting personal gains helps people persist with behavior change, particularly if the target behavior is altruistic. In addition, aligning with prior multiple behavior change research, targeting multiple health behaviors sharing the same risk factor or same intervention goal at once has the potential to maximize intervention efficiency by enabling people to see multiple health gains. Future research can further examine effective ways of highlighting multiple personal gains. Thank you for listening. Please check out our paper for more details.